Now that we've talked about some of the major side effects of sedative hypnotics, let's now talk about some of the problems with abuse rates with sedative hypnotics. So many patients don't realize how addictive or abusive these drugs can be due to the fact their doctors don't actually believe that these drugs are very abusive or have at a rate where they can overdose and things like that. And so for that reason, many patients sometimes take 2 or even 3 times their allotted prescription just because they feel like they can't go to sleep, and it wouldn't hurt them to take a little bit extra medication, which is very scary and dangerous. Between the years of 2006 and 2011, over 38 million Americans were prescribed sedative hypnotics. That is just an outstanding rate at which someone's being prescribed a pill just for anxiety and like sleeping problems. And even after that time, those numbers have not decreased, they actually increased, even though this drug is very abusive. And actually, most of the time, many patients don't realize that they're actually abusing the drug or that they have a problem with it until they decide that they want to not use the drug anymore, and they start going through withdrawal symptoms. Things like having several failed attempts to try to quit the drug, getting cravings for the medication when they're not on it, seeing more than one doctor for try to get prescribed for the same drug, or experiencing frequent memory loss when they're on the drug. Now, these things are very dangerous and should not be abused, but people have been taught that these drugs and other drugs are not that dangerous, and for that reason, doctors need to inform their patients better about what these drugs really are and how to prevent abuse and things like that.